Action.
Hello everybody, my name is Jason Finkelstein. I'm one of the fourth year medical students. And by my side is a fellow fourth year medical student as well, Paul Goodwin. As you can clearly tell, he's going into orthopedics. So today we're going to be doing the musculoskeletal physical exam. The important thing about the musculoskeletal physical exam is that you'll be having a lot of patients coming in presenting with very similar symptoms, and the key to develop a broad differential would be the physical exam, which will help differentiate those symptoms. So essentially today I'll walk you through the physical exam. It's a long physical exam, so I guess bear with me. We're going to inspect the extremities and we're going to compare bilaterally, see if we can find any misalignments, any symmetrical differences that are seen, any size differences on both sides, as well as any deformities that might be seen. We're also going to inspect the skin and subcutaneous tissue over the muscles and joints. And once again, we're going to be doing everything from the hips up for our musculoskeletal exam. We're also going to inspect the muscles bilaterally and compare the size, symmetry, any spasms or fasciculations that we might find. We're going to palpate the bones, the joints, and surrounding muscles. We're going to look for any muscle tone difference, any heat, any tenderness, any crepitus or air that might be underneath the skin, as well as any swelling that can maybe be cause of infection. We're going to also test each major joint for both passive and active range of motion. You want to remember that you're always going to want to check for passive and active range of motion, and you're going to also want to compare them bilaterally. We're also going to test each major muscle group for strength, anywhere from the shoulders, the arms, the wrists, pretty much those. And we're also, depending on the chief complaint, you're also going to want to maybe evaluate more than one joint or muscle group, depending on, like I said, the chief complaint. So I'll go wash my hands, as you're supposed to do for each physical exam. And it's a little cold in here, right, Paul? It's pretty cold. So we're going to start off with the hands and wrists. Essentially, you're going to inspect the dorsal and palmar sides. You're going to look for anything from size, symmetry, digit completeness, especially you want to actually check to make sure they do have 5 fingers on both sides. So you're just going to check both sides, right? 1, 2, 3, 4, 5. You're going to turn them over. Once again, 1, 2, 3, 4, 5. Good. Both sides were normal bilaterally. You always got to compare bilaterally. The thing when you do a physical exam, especially on the hands, you can develop some things called Heberdine's nodes, which are basically bony outgrowths that you can develop on the DIP joint, mostly in this joint right here. Those are usually indicative of pathologies, especially that of osteoarthritis. You can also get something called Bouchard's nodes, which are going to be more on the PIP joint. Once again, it's like a bony outgrowth, bony swelling. The PIP joint is going to be right around here, and it's usually indicative of something called osteoarthritis as well, or even rheumatoid arthritis. So the thing with the hand and wrist, you're going to want to palpate each joint. You want to palpate the wrist. You want to palpate each joint of the fingers as well. Check for any swelling, any tenderness, any pain that's elicited upon the palpation. After palpation, you really just want to check for range of motion of both the wrist and as well the fingers. You want to check for hyperextension, abduction, adduction, flexion as well. So with the wrist itself, you want to check for extension. You want to check for flexion. You want to check for radial and ulnar deviation as well. And as you can tell, all are normal as above. You also are going to want to see if they can form a wrist, which shows the proper usage of the wrist itself. Form a fist, proper usage of the fist. There you go. In addition to after checking range of motion, seeing if they can move their fingers spread out apart, if they can close them together. Perfect. You want to check the strength of the wrist and also the fingers. So I'm going to have him do a couple things. I'm going to have him see if he can do a hand grip. Good. And then I'm also going to see if he can maybe spread his fingers apart. I'm going to see if I can close them nice and tight. And then I'm also see if he can close his fingers and see if I can spread them apart. Once again, I'm checking for strength of the individual fingers. Excellent. There's a couple special tests that you can check, especially for the wrist. The biggest thing that you guys are going to encounter is something called carpal tunnel syndrome. There's 3 main tests. One's the Tinel's, one's the Fallon's test, and one's also the compression test. So the Tinel's test is basically you're going to have him in a supination position. You can have him either relax on a table or something of that nature. I'll have him relax on my hand. And you're going to want to tap the distal end of the wrist. And you're just going to do a nice couple taps. And the trick is you want to see if you can elicit any type of numbness or tingling in the first 3.5 digits. If you do, that's a positive sign for compression of the median nerve in the carpal tunnel. The other one is the Fallon sign. It's essentially as he's demonstrating right here. You're going to want to hold your hands together. You're going to flex 90 degrees both at the elbows, the wrists, and also the wrists and the shoulders. And you're going to have the patient hold it there for between 30 and 60 seconds. If that patient does start developing numbness or tingling in the first 3.5 fingers, once again, that's a positive sign for carpal tunnel syndrome as well. The compression test is something that you guys maybe not have heard of. It's basically you're going to take both thumbs, once again on the distal part of the wrist, forearm. You're going to compress it. You're going to hold it there for another good 30 seconds. If you're able to elicit that numbness or tingling in the patient again, once again, another positive sign. The fourth sign, or fourth test that's a special test that you might not have heard about, is the thumb abduction test. It's a test that allows you to see if the abductor pollicis brevis is intact. So what you're going to do is essentially have him relax, see if you can abduct his hand, his thumb, and you're going to want to have him resist pressure. You're going to want to put back the thumb where it normally was. So if you can resist me pushing it back, perfect. The fact that he can withstand my resistance or withstand the pressure that I was pushing means that his abductor pollicis brevis is intact. So moving on from the hand and wrist, we're going to go into the elbow. Essentially with the elbow, you're just going to inspect it. You want to check the extension and flexion and see if there's any change or any pain that's elicited when he's changing positions. So if I can have you just go from extension to flexion of your wrist. Any pain or any trouble moving it? No pain. Other side as well? Once again, you always want to remember you want to do bilateral sides so that way you can compare and get a good feel for normal versus abnormal. You're going to also want to palpate the ulnar side of the okernon, however you pronounce that. Any pain or tenderness when I press on this?
No pain on my okernon.
There you go. You also want to check the bursa to see if there's any swelling or tenderness as well. Any pain or palpation when I'm pressing it down there?
Not on the bursa.
Thank you very much. He's going to ortho, so he knows how to pronounce all these big words. Next thing you want to do is you want to check the medial and lateral epicondyles of the humerus and see if there's any pain or when you're palpating that. So once again, you have the medial aspect right here, and you have the lateral aspect. Any pain or palpation? Any pain on palpation?
No pain on palpation.
Any pain on palpation?
No pain on palpation.
Roger that. Last thing you want to do with the elbow is you want to check for range of motion. Basically any flexion, extension, pronation, and supination. So I'm going to have him check both sides real quick. I can have you flex, can I have you extend, and then with both hands holding a bowl of soup, can you pronate, supinate? You did very well, thank you very much. Moving right along, we're going to check the shoulders. So essentially with the shoulders, you're going to inspect the shoulder girdle. You're going to check for symmetry, you're going to check for contour, you're going to see if there's any scars from my previous surgeries, you're going to check for erythema, redness, or even swelling, which can be a sign of injury. So once again, shoulder girdle, you're just going to inspect, make sure there's no obvious deformities before you start playing around with it. Once again, you can do the same thing on the other side as well. You're going to want to palpate the joint space. So once again, inspect, then palpate. You're going to inspect you're going to palpate the joint space and the soft tissue of the bone and shoulder, just looking for any tenderness that you might elicit upon palpation. Following that, you're going to do the range of motion. So essentially, you're going to have them do a couple things. You're going to have them shrug their shoulders. You're going to have them do forward flexion, hyperextension, abduction, adduction, internal and external rotation of the shoulder. The shoulder is one of those body parts where it's a very tricky joint, and there can be a lot of injuries that can be going on in the shoulder. So it's very important to see if you can get a good exam of this. So like I said, we're going to try and see if you can do shrug. Excellent. Next thing we're going to do, we're going to see if you can do any forward flexion of your arm. Bring that down. The other arm. You're going to see if you can do extension. Excellent. Extension of the other arm as well. And then you're going to do AB and abduction of both arms. So essentially, you're going to want to bring out abduction, and then adduction is bringing it in. And then That's also, you can do all that, and then internal and external rotation. Good. So essentially for strength, you're gonna wanna basically check the shoulders, see if they can shrug and resist, and then you're also gonna wanna do internal and external rotation, see if they can resist that as well. So I'm gonna have you lift up and see if you can press against, lift up, excellent. And if you can have you go like this, push out, against, excellent. And if you can, push in, perfect. There's 3 main special tests that you can do for shoulder injuries. They all 3 of them actually are able to show injury to the supraspinatus rotator tendon. One of them is called the near sign, the second one's called the Hawkins sign, and the third one is the empty beer can test. Essentially what the near sign is he's going to stick his hand out like this, and I'm going to passively flex his shoulder and see if I can elicit any pain. If I do, it's positive for a supraspinatus injury. So if I can have you just put your arm straight out, and I'm going to passively move your shoulder. Let me know if as I move it, if I'm causing any pain. No? Good, no pain. If I was to elicit it, therefore it would be positive for supraspinatus. The second test that you can do for a possible nerve impingement of the shoulder would be the Hawkins sign. So essentially what you're going to have him do is, you're going to have him flex and internally rotate. You're going to hold his elbow here, and then what you want to do is you want to try to bring his hand down like that and see if you can elicit any pain in this area as well. Do you have any pain when I move the hand down like that?
No.
Excellent. Him being negative also shows that there's no supraspinatus injury. The third and final sign that you can do is an empty beer can test. Essentially is he's going to abduct and then what is that? Internally rotate?
Point down.
Point downwards, I guess. Point downwards. So as you're going to abduct first, and then you're going to want to internally rotate. You're going to want to push up against my hand. I'm going to push down. Does that hurt when I press down?
Does not.
All right, therefore you do not have a supraspinatus injury, my friend. All right, moving right along, we're going to go into, who's the famous rapper? Iggy Azalea. As we've been known, Iggy Azalea now has TMJ, or temporal mandibular joint dysfunction. We're going to check on my friend right here, see if he chews too much gum or clenches his teeth. So essentially with TMJ, you're going to palpate the joint, see if there's any clicking, popping, or any pain elicited upon movement and palpation. And then next, you're going to, after palpating, you're going to want to see his range of motion. So it's kind of right under the ear. So can you open your mouth? And you're looking for any, you're hearing for any popping, you're feeling for any like clenching, or anything of that nature. All right. Next thing you want to do is then check for range of motion. You want to have him open and close his jaw. Any pain? Excellent. Excellent. You're going to have him move his jaw to the side, left and right. Besides looking like good. No TMJ dysfunction. Last thing you want to have him is protract and retract the jaw and see if there's any clenching or popping or pain. No?
No.
Excellent. My friend has no TMJ dysfunction. Well, second to last thing we want to do is the cervical spine. Essentially, you want to inspect the neck and check for any alignment and symmetry, essentially, in the back of the neck. So as my friend, you get a good side profile of my friend right now. You're just going to take a look and see if there's any, you're going to want to check for symmetry and make sure the spine is nice and straight as it is. After you check that, after inspection, you want to check for range of motion. You're going to have him do flexion, extension, lateral, and rotation. So if I can have your head, just have your chin touch your chest. All right, we have flexion. If I can have you take your head back, extension. If I can have you turn your head to the left and right like that, that's lateral. And then if I can have you turn it to the side like that, good, that is rotation. No pain or anything of that nature? Excellent. Next thing we're going to do is going to do strength. You're going to check for sternocleidomastoid strength as well as trapezius strength. So sternocleidomastoid, the best way to test for this is you're going to put your hand on one side and you're going to ask him if he can turn his head to that side. Any pain?
No.
If he did have pain on this side, that would have been positive for sternocleidomastoid. We're going to do the same thing on this side. Any pain? Once again, he's using this. There was no pain, no sternocleidomastoid injury. The second we're going to do is for trapezius strength. Best way to do it is just have him shrug and have me push down. pain? Any weakness?
No
Good.
weakness.
Last thing we're going to do is the thoracic lumbar. Basically, you're going to want to just inspect and palpate for alignment, and you're going to want to palpate for any tenderness. Also, remember you want to do paraspinal palpation, which is going to be more muscular in nature, and then also right down the middle, which is going to be more spinal in nature of a pathology. So I'm going to press down on the sides. Any pain or tenderness as I'm moving down?
Nope.
All right, I'm checking these paraspinal muscles, and I'm also moving down, checking these vertebral bodies. Any pain or pressure when I press down?
Mm-mm.
All right. There's no step-offs or anything of that nature, which would make me think that his spine is not normal. After that, we're going to check his range of motion. If I can have him stand and give you a good flex, then it is a gym. So that's flexion. Any pain?
Nope.
Good. That's full range of motion as well, as he can touch his toes. Next, we're going to have extension. Any pain or upon extension?
No.
Excellent. Okay, we're going to have to do lateral. We're going to have him bend side to side like he's doing side crunches. Clearly, he needs to do more. And then we're going to have do rotation. All right, perfect. So we have two tests that we can do for the thoracic and lumbar spine. We can do the straight leg test, and we're also going to do the femoral nerve test. The straight leg test is pretty basic. You're going to have him lay down. You're going to help him, always remember you're going to help him pull out. We didn't drape him because we couldn't find the drape, but always remember to drape your patient. So the straight leg test is basically, it's a passive range of movement. You're going to take his leg and you're going to raise it for him. When you reach around 45-degree angle, you want to kind of dorsiflex his foot. If upon dorsiflexion, if he's complaining of any pain down that leg, that's positive for sciatica or nerve impingement in the lumbar spine. So I'm going to raise your leg. Just relax. Let me do the raising for you. All right. You're going to dorsiflex. Any pain upon movement?
Mm-mm.
No? No
Mm-mm.
pain shooting down? Excellent.
Mm.
Always do everything bilaterally, so you're going to do the same thing on the other side. Passive movement. Let me do the movement for you. Just relax. Any pain now?
Nope.
All right. Good. So both signs, both legs show no cause of sciatica. Next thing we're going to do is the femoral nerve test. It's kind of an interesting test. I've never seen it done, but it's on your checklist. So if I can have Mr. Paul Gwynn roll over on your belly. Excellent. So essentially what you're going to do is you're going to have him flex his leg like that, and you're going to put one hand under his knee. Essentially you're going to lift the entire leg and knee up, and if he has any pain on the interior compartment of his thigh, pretty much in the femoral region, that's positive for a femoral nerve test. And it's basically inflammation of the femoral nerve. So like I said, I'm going to do the passive movement for you. You can lift up like that. Do you have any pain in the anterior component of your thigh?
No.
Good. Thank you, my friend. We're going to do the same thing on the other side. You're going to flex his knee. You're going to passively grab his knee as well, and you're going to lift up. Do you have any pain or shooting pain down the anterior thigh?
No.
Excellent. And there you had the femoral nerve test. You can sit back up. And there you have the musculoskeletal physical exam for the hips up. It was a pleasure doing this for you, and best of luck.